All right. Hello, everybody. Welcome to another episode of A Fresh Perspective with Jeff Charles, where we prefer, you know what we prefer. We prefer truth over narrative and principles over politics. I've got another great interview for you today. If you've been watching my stuff lately, you know I've been talking about healthcare quite a bit. It's become a subject that I've been interested in. And my guest is going to be perfect for that. But before we get into everything, you already know what I'm going to say. You got to like this, you got to share this. And you have to subscribe. If you're not subscribed, I don't know what you're doing with your life. Hit that notification bell. That way you'll be notified whenever I upload a new episode. Also, check out my Substack called Chasing Liberty. You can access that at libertychasers.com. I'm loading it up with all kinds of liberty content, articles, videos, all that great and goofy stuff. So check out Chasing Liberty at libertychasers.com. Become a subscriber. Support my work. I highly appreciate it. Now, without further ado, and I've been wanting to make this happen for quite a while. We've known each other for like quite a few years. I don't even know how long yet, but I have Dr. Nikki Johnson with me finally. How you doing, sis?
Yay! I'm so glad to be here too. Yeah, I know lots of things, lots of good reasons that we put this off, but I think the timing is really good. So thanks for having me.
Yes, indeed, indeed. So before we get started on everything, why don't you kind of tell us a little bit about yourself, your background, and just the wonderful story of Dr. Nikki?
Okay, let me I guess I'm gonna give you the short
Okay.
short version. So just we'll just do kind of the professional stuff, but I'm I'm a mom, I'm a wife, and I am trained as a physician in general pediatrics and pediatrics intensive care, most part. And I do have a background in training in adult medicine and pediatrics as my original kind of specialty. And so I practiced for over 20 years, and then I left my clinical practice in 2022. And the short reason is burnout is what is one of the big buzz phrases. But really, there was a lot. I was trying to do a lot of work in just advocacy for patients, for physicians, for children, and a lot of the policies that I was pushing for was clashing with the medical establishment, and it was
Mhm.
getting harder for me to work in that environment. And so um, I felt like I could best serve myself, my family, and my community by leaving it. So that's kind of where I am right now, working
Okay.
independently. It took about a year
Yeah.
for me to get to the place, where I could actually use my expertise and actually get paid for doing it. So
Yeah. And actually
outside of
help people for
clinical
a change.
practice.
No, I'm just kidding. I'm sure you were helping people before. Um,
Yeah, yeah.
So, but here's the thing. I want to understand what got you interested in the medical field in the first place. And the only thing I could guess is that it's just so easy for Black people to become doctors. As far as I understand, I've been reliably informed that you can just walk into a doctor's office as a Black woman with a butter knife and say, "Hey, I want to be a surgeon. Hire me. I'm Black." And they have to hire you because you're Black because of DEI. So, can you explain kind of that process to us? That is how it went, right? Because I've been seeing it all over the place. So it's got to be true if you see it on Twitter.
Pretty much, man. I just graduated from high school, and then all these medical schools started, asking me to come. But I went to college first, and I told them they had to wait. And just hot commodity being a Black girl out of the hood. Part of the time, my mom was a single parent 'cause my parents divorced young, so I was checking all the boxes, and they just
Mm.
asked me to do it. DEI before DEI was even a thing. So,
Yeah, it was
so
it was
that's how it goes.
pre-DEI. Yeah, it was like the warm up to DEI, so that all these Black doctors just
Yeah.
can walking off the street and become doctors. No school.
Right.
I actually do want to talk about that for a second, but I actually am curious. What made you want to get involved in this field?
So, the funny thing is I was actually just sorting through because we just moved. I was sorting through tons of 20 years of accumulated stuff in my house. And I came across my medical school application
Mm.
and my personal statement And it's very funny that I remembered that it really was the reason why I went into medicine. I grew up watching the Cosby Show, and I looked at Huxtable and saw, his big family, his professional wife, and seemed to enjoy his field. Now, yes, it was television, but as a young girl, in my mind, like this is, I'm seeing this professional family
Mhm.
and I grew up in a place where that wasn't the norm. I mean, it was pretty lower middle class where I worked, people went to work, but where I lived and had families, dads at home, all of that stuff. But um, I didn't know any outside of my own doctors. I didn't really know any doctors. I didn't know any attorneys. And so I was just fascinated by that. But the thing that really struck with me the most, it just he seemed to really enjoy his patients, and he really wanted to. He really tried to make them feel comfortable, get to know them, and then really do good for them. And so when I went to medical school, I was thinking I would do either primary care, like as a family physician in my neighborhood, open up a shop, because that's how I grew up too. We had like independent medical practices around the city, and we could either walk or take a short bus ride to the doctor's office. It wasn't where you had to go to some big system building and then get checked in and do all of these fancy things. Everybody, you knew your doctor, the doctor's office knew you knew the nurse, you knew the phlebotomist. I mean, all of those people. And so that was what I saw myself doing, um, was something along those lines. And I figured, like, being a family practice doctor, OBGYN, I could do OBGYN too. And so I
Mhm.
could take care of my community, that kind of thing. So it all sounded great until I actually got to medical school. And I realized, I mean, that I grew up in the era where all of this was changing before, unbeknownst to me. But independent practices were dwindling. They were starting to encourage people to be employed by larger systems. And this was sparked by the HMOs basically taking over insurance policies. So you
Mhm.
had HMOs coordinating with or contracting with corporations to get people on these large health plans with a panel of doctors, a panel of places that they could go, plan of medications, formularies of medications that you could pick. And that's how medicine really evolved. So by the time I
Mhm.
got into school to learn, um, that was that was the way it was. I mean, there was never any discussion during my medical education about going into private practice and doing your own, or teaching us how to the business side of medicine. It was all like, you're going to learn all of this stuff, and then
Mhm.
you're going to go and you're going to be employed by somebody once you graduate. So, but where I ended up picking my fields, because when I got to OBGYN, the funny thing is that when I got to that rotation, I hated it. And, I love the idea of this bringing this new life, this miraculous life into the world. I thought that was just so cool and so miraculous. But when I realized that the human body does so much on its own, like the mom, really, and the baby do a lot to actually get the baby delivered. It's
Mhm.
just funny. The baby gets itself in the right position, all of these things, and all the doctor is doing is really kind of helping and then making sure there are no complications. And so I was just like, I don't know, like that I'm really doing anything here
You're just overseeing the process.
for this. Yeah, and staying up late at night, and there's surgeries that they do as well. But in terms of like forming connections, for me at least, I felt like I was most comfortable in the intensive care unit, as I felt like I liked taking care of really sick patients and people. I knew, for me, it was a privilege to be able to take care of people in their most vulnerable state, period.
Mm.
That's how I looked at medicine. That was how I I looked at medicine as my personal calling. And so I felt, and it was because of the human connection there. And I always, to this day, I still believe that. And I felt like I could get that in the intensive care unit because I could actually sit and have more time with the families. And talk them through really, painful, really challenging, scary times, and even death. And I just felt like I was a natural at it. And it just, like, every single one of my intensive care unit rotations, I looked forward to every single one of them. And so that's how I ended up in that profession. So
Interesting. Okay.
I also love to teach. Being a physician means you also have to teach people things
Yeah.
from your patients. You have to, you can't, you have to be able to explain it to people on a level that they understand. But you also have to you also have to just really form human connections with people in order to actually teach things too. And so there's a lot of a lot of education. And then, of course, you're teaching the generations that follow behind you how to do it the right way, how to learn the science, how to apply that science to patient care, and then really just how to build relationships with people, because really that's what medicine is. You're not using your knowledge and then communicating that with people and then forming a plan together, to care for them. And so yeah, so I love doing that as well. So
Mhm.
I did a lot of education, in my background, love training residents, talking to new medical students or people who are interested in medicine. So I did a lot of that, really enjoyed that.
Awesome. Yeah, and it sounds like when you first started considering getting into the medical field, like you said, you had this vision of, having your own doctor's office, being a part of the community and things like that. And then it didn't quite turn out that way, but at least in intensive care, it seemed like you still had some of that feel to it. But you also mentioned that a lot of the independent outfits have gone away. And I just read like a week or two ago that there have been so many mergers of medical organizations over the past few years, like an alarming amount. And it's projected that it's going to be even more. So you have all these smaller outfits merging into one. And
Yeah.
in some cases, in some areas, they're probably going to have a monopoly over that region, whereas the independent
Yes.
operators kind of going by the wayside. Why did that happen? Like what forces kind of brought that about?
Okay, so that it's, really multifactorial, but the driving force, of course, is it's a business model of medicine. So it's corporate.
Mm,
Once we started allowing HMOs to contract and with employers and sponsor, health benefits, a lot of the decisions made in health policy were influenced by these big insurers, or third party payers. And then you also have, other major entities in the ball game too. So insurance carriers are contracted with large group purchasing organizations. Those organizations help to purchase all of the medical equipment, the medications that go on a formulary, like while you're inside in a hospital, or a large health system. They determine, they have different contracts with each health system. And so they control how many ventilators you have, where you get the ventilators from, where you get your pharmaceutical agents from, that kind of thing. And then on the outpatient side of things, they're the pharmacy benefit managers. And those, both of these companies, or these entities, set out to be, to negotiate good deals for patients. And sort of the idea was to get patients the best quality, and the best efficient care, and then with the insured, to make sure this is all standard and based on evidence, all of those things. But what it became was of course, the nasty side of capitalism is how can we get the most out of this? And so in the 80s, Stark laws became a huge health policy change. And that required physicians to disclose all of their conflicts of interest. But the organizations that were exempt from that were group purchasing organizations and pharmacy benefit managers. The reason why they claimed exemption was because they felt that if their contracts were open and transparent, then patients wouldn't get the best deal from it. And so at least that's what they told us all. And so, but when you follow the money, you learn that they are restricting choice really for patients. And then the big G, government bureaucracy is in the middle of this as well. So government bureaucracy and regulations all play a role in how the healthcare corporate conglomerate works. A bigger corporation can handle tons of regulations. A smaller private practice can't necessarily handle all of these government regulations. The Affordable Care Act was a huge turning point, like a pivotal point in regulatory burden. And that's when we really started seeing a ton of private practices, independent practice folding and getting gobbled up by these large corporations. Because one of the biggest things is what they demanded electronic health records.
Mm-hmm.
So every single, clinic and, operating in healthcare was required to go on an electronic record. There's a big overhead price for that. And they, for a large corporation, they can handle that and then have somebody, an IT department 24/7 available to troubleshoot and help maintain those systems. A smaller practice, especially in a rural area, does not have that. Or nor do they have the broadband internet connection to be able to handle that as well. And so that's one of those regulations. HIPAA was another one. It really is a violation of your privacy. It is not necessarily a protection of your privacy because it allows all of these third parties to have your medical information. And so more than anything. And so there's a great book about this written by Twyla Brace. She's a retired nurse who wrote it. It's called Big Brother in the Exam Room. So that's a great book about like HIPAA and all that. So people are interested in that. And so people couldn't, I have a friend that I met on social media who finished high school early, got into medical school early, finished early, and then became a surgeon and was a great like breast surgeon, had her own practice. And once this passed, she was unable to keep up her practice.
You're talking about the
Affordable Care Act? Retired early because of that. Yeah. And so what's happening now is a lot of physicians are retiring early. Many are leaving practice of healthcare altogether because along with these government regulations, a lot of these requirements then trickle down to the actual people taking care of the patients. So you're doing more charting to meet demands for insurance companies, Medicare and Medicaid. You have to document pretty much every single thing that you do in a way that can be billable and that you can get reimbursement. The second part of it is reimbursement rates are going down dramatically every single year. So to keep a practice open is really difficult, especially when you're in a location that takes care of a lot of patients who are on Medicare or Medicaid. The reimbursement is pennies on the dollar, and it's only getting worse. And so And then you have each state has a requirement that you demonstrate a certificate of need
I just did a
before
video
you
on
can
that.
open a before you can open a medical practice. So you have to make sure that you meet the guidelines within a certain radius, that there is no other, coverage for these patients. But you've got these large corporate entities now buying up every single practice. So they are basically monopolizing all of the need-based population. With the exception of the rural areas, which in some cases, a lot of the community hospitals are either closing or they've merged with these larger corporations. But in Texas alone, you may know, there were like hundreds of community hospitals that closed, since the years of the Affordable Care Act, and it is leaving a lot of people without access to actual care. So that's kind
Are you
of
suggesting that when the
like the
government
big
tried to make this
Pac-Man
better,
eating
it
up
made it
all the.
worse?
Well, hey, it gave everybody insurance. If you take nothing away from this conversation, insurance does not equal care, does not equal
Yes.
access to care.
Yeah, and you know what's interesting? Especially just because I've just dipped my toe into this whole thing and I'm already learning quite a bit. And it just seems like, like you going back to what you were saying about capitalism. Yeah, I'm a capitalist, but it's got flaws. And there is probably
Yep,
the least imperfect system. But it seems to me that the real issue with healthcare, and especially a lot of things that you listed off, that's telling us why we're paying so much for healthcare, and we don't even know what the
yes,
prices are going to be. But the real issue is that the government and corporations are in bed together, and they are very
yes,
intimately involved, especially after the Affordable Care Act. It didn't start with it, but
yep,
it magnified it, it accelerated it, and they are just so
absolutely,
intertwined in ways that we don't even think about, like certificate of need laws. I mean,
absolutely,
to go through that
yes,
process to apply to add on a different extension to a facility or to build a new facility, there's like a period of open comment where your competitors can come in and say, no, don't let them build that here. They don't need it because we
yep,
provide it. And it's just such a nasty, cronyist system at this point, and people are blaming it
yeah,
on the free market. I was like, no, healthcare ain't a free market. Yeah, we're not Canada,
right,
but
yes.
we just about might as well be.
We we have government sponsored healthcare right now. We
Yes,
really do. I mean, we government controlled healthcare. People do not realize that. And if we learn anything from the pandemic, that's what people should get, at least, from the healthcare side of things, was that a lot of this is controlled from the government and obviously current healthcare policies, and these small entities, none of which have any medical knowledge, don't take care of patients, don't do any research, and don't have any direct relationship with you and your doctor. So think back to the beginning of the pandemic when there was a shortage of personal protective equipment, gloves, masks, gowns for all of us healthcare workers who worked in the hospital.
yes,
That was because, and even ventilators. Everybody blames Trump for, disbanding the pandemic task force or whatever. But the reality is, um, the group purchasing organizations, the pharmacy benefit managers, the people who have control over what hospitals buy. So the GPOs basically distribute, they act as a distributor. Oh, and it gets even worse because these companies now have what they call vertical integration, and they can, like, a large PPM can have its own group purchasing organization, by the way.
okay,
So they and then have its own kind of healthcare facility too. So there's a lot of merging happening in that space. But so they control which company you get the ventilators from. There was a 60-minute episode on this. I wish if I could find the link for you. It was actually really great, and it actually went through what group purchasing organizations are and that kind of thing, and then and it showed like the distribution of like very necessary materials. But anyway, so your hospitals are in a contract that no one else can see, that they have to purchase their equipment from X distribution center or X manufacturer. So if we're short on ventilators, and because these people have so much control, we may only have one manufacturer of a certain brand of ventilators or a certain type of ventilator. And so, I mean, and just keep this in mind. Obviously, we now know that ventilators actually kill people with COVID, but that still was, but what we knew, in medicine was people who have respiratory failure need to go on a ventilator. So that was what we knew. But yeah, we were short. And we were short because we only got it from someplace. A hospital could not go outside of that contractual obligation to purchase a ventilator from somewhere else. So if GE decided that they wanted to start making ventilators, at a little district, little company that's nearby, the hospital could not then contract to purchase those ventilators. If Mike Lindell decided to make masks, the hospitals couldn't go and mass purchase masks from Mike Lindell's company. I had physician colleagues and scientists who were making products, and hospitals were refusing to purchase them. But we were allowed to purchase on our own. So I could go to Amazon and get, or Home Depot, and I can get myself a high filtration mask when I was, to take care of patients myself. I could do that. No reimbursement, mind you. But we had to wait until we got our distribution of PPE. And so we were rationing our own PPE. I mean, I still remember like stockpiling N95 masks in my office because they were going to come and steal them. Somebody was going to come and steal them because people did, come around and steal from different departments because we were so short. And so that is the reason. Shortages of the medications, huge. And you did I think you did on this, right? And the outsourcing of our generic prescriptions mainly to China, like the mineral base, basis of these drugs are India, and China.
I haven't gotten that deep into it yet, but I've kind of touched on it. But yeah, I haven't gotten that deep in it. So go ahead, definitely.
Yeah, 99% of our generic drugs, the base of that drug or the base minerals of that drug are from China. And so then China is responsible for making most of our generic drugs. So we are highly reliant on China for those things. We are also reliant on China. You think like the average human loves getting cheap stuff off of Amazon? So do group purchasing organizations. They're going to save you money because China's going to make the mask. Well, what if China decided they wanted to hoard their mask? Oh, that did happen.
Wow.
It happened because we globalized, and outsourced our materials. I mean, I don't understand. Like for me, that's a national security problem. First of all, I could see maybe if we decided to use Canada as the place we're going to get this stuff from, or even Mexico. But one of our biggest, if not the biggest enemy on the world stage,
that's absurd.
Giving them the ability to make our medications and our personal protective equipment.
So wait, where do these GPOs get the authority to determine who buys from what? Is it just the authority of the contract, or is it government backing this?
Yep.
These then
pharmacy so it's the authority of the contract and the government. Okay. And that part of a lot of my health policy through Free to Care, freetocare.org, plug that, where we've written 2 white papers on how to lower the cost of medical care. And we have focused primarily on these big entities in terms of lowering the cost of care and also bringing transparency to these contracts. Like, we want them, they should have to comply with the Stark laws the same way the rest of us do. Everybody should be disclosing conflicts of interest. That should be a no-brainer. But we've had such trouble trying to we've gotten quite a few representatives on the Democrat side and the Republican side to write great legislation, but none of it never leaves committee in a way that people agree, because these lobbyists have so much stake in the game, and they're on Capitol Hill every day. As a working physician, I can't just go to DC every single day and lobby on behalf of patients. I'm obviously, it's just impossible. And so we don't have a strong lobby. Our major organizations, the American Medical Association, these large entities are supposed to be doing this on our behalf, but they have a stake in this too. So every single large organization is embedded with each other. There's money trails. They're all in cahoots. They're all together. And so you don't have people pushing back against this at all, on behalf of patients. So I will say though, Roger Marshall, who's senator from Kentucky, and Bernie Sanders of all people, asked for physician input to get around all of this, because what we're seeing is the PBMs, the insurers, they're going to find ways to hide what they're doing. And as I mentioned before, because they're now vertically integrating, so a large pharmacy benefit manager, like say CVS Express Scripts, or they can have a group purchasing organization and offshore that, say somewhere in Switzerland, and then work together, but they're under a different name, even though they're in contract with one another. And we actually had our attorney general in Ohio actually sued for a corporation for this very specific thing. And I'm blanking on who it was at this point, but I can pull it up. I actually wrote an article about it. For some reason, I'm blanking. This was probably over a year ago that this happened. But you can sue all day, but these companies are going to find ways to protect themselves. And so what's left for us to do? And especially people who don't know what's going on, the poor patient cut at the bottom of this, all they see is the doctor and the nurse, and then that bill that they get. They don't know anything else. I mean, I used to get people calling my office in the hospital telling me I overcharged them. Like, I didn't charge you anything. The hospital and your insurance company worked that out. I had nothing to do with it. But that's what it's such a complex thing that's what people have they don't know who to call about it. And so Roger Marshall and Senator Sanders both really are trying to work on a way to go around it. And so they asked a group of us to kind of meet and brainstorm together about how we do this. And honestly, the best answers that we can all come up with is completely get rid of insurance in the first place, because then you don't have these people competing with each other and hiding things. It's going to be a painful process. Yeah, no insurance. You can have something catastrophic if you want to make it a voluntary thing. Do not require people to have it. Create healthcare savings accounts for everybody. That's tax-free savings, portable to, no matter where you go, because right now, if you get a healthcare savings account, it's tied to a high deductible insurance plan that you get from your employer. So if you leave your employer, then you can still use what's left in your account, but you can't add to that account on your own at all. So you don't have another way to create a tax-free healthcare burden for yourself. but the cost of medical care is really cheap. And if you really, if the medical industry, what I call, what one of my friends calls the healthcare cartel, was really interested in keeping people healthy, then we would focus everything we could on prevention
Yep.
and nutrition, exercise, all of the things that keep us in a state of health, or return us to a state of health, rather than having our primary focus on things that we can do to you, like prescribe medications, inject you with vaccinations, perform surgeries, take off your limbs like we're doing, your genitals like we're doing with kids who have, basically young adult stress about their bodies. And so if we return that focus, healthcare is cheap. So a lot of my doctor friends are finding, like, reclaiming their joy in medicine. They've either left a large corporation or changed their independent practice into what's called a direct primary care practice.
Okay.
And they are loving medicine. They get to spend as much time as they want with their patients. They have a panel of patients that they can, decide how many they're going to see. But their patients have 24/7 access to them, and they pay a monthly fee. So I have a family practice doctor who's a direct primary care doctor. I pay $90 a month, so much cheaper than my family cell phone bill,
Right.
even, or an individual cell phone bill, or your satellite bill per month. I get to email her, text her, call her, as much as I want, and I get, or come and visit in the clinic as much as I want. So I'm fairly healthy. I've got some chronic, autoimmune disease, but someone who's not healthy would really benefit from this, because we know that primary care actually keeps patients out of the hospitals. If you have a regular physician that you see regularly, who knows you, who knows your family, they can keep you out of the hospital. And it's easy to open up a direct primary care practice. I mean, yeah, you're gonna pay some overhead, but if I want to do this out of my basement, like doctors used to do, or turn, a first floor of your house into your practice. Yeah, like, yes, and do house calls. A lot of these doctors do house calls, and a lot of people think this is like only for the rich, only for rich people. But this is, they are able to serve patients, which we will always need some sort of safety net for people. Um, you can decide who's taking care of you and your family, and you save dollars. The other piece is, with the insurance out of the picture, is you don't have to worry about the prior authorization. So if you and your doctor want you to have a certain procedure or a certain medication, you guys get to decide. The people who know you and know you best get to decide. Now, granted, yeah, there should be some oversight, and somebody looking and making sure that people aren't harming people, and doing crazy things with medications
Sure.
and supplements and things like that, that are lying to people or poisoning people. Obviously, we need that. We need some sort of regulation oversight of that. But the people who know you the best are you, and the person directly taking care of you, and you should be able to decide that. Right now, we don't really have choices.
Yeah,
You
we have
pick an
such a
insurance
lack of
plan, you go
control.
on that insurance plan. Yeah, you have a list of people that you can see, and if you go out of that, you have to pay more money for that. Oftentimes, you may not even get a physician. If you want a physician, you get assigned a physician assistant or a nurse practitioner. And if you want that, that's fine. But if you don't want that, it's assigned to you. And so, like, there are so many things that are beyond your control. Your doctor wants to prescribe you the trade name of some drug because it's better than the generic, or they want you to have the generic of some drug, and the PBM took it off the formulary because they want to put a more expensive drug on
Okay.
on the formulary. This happens too.
Yeah, so it's
you
almost like the
lose those
healthcare
choices, and then
industry.
your doctor.
It's like healthcare. This is going to sound weird. It's almost like healthcare has its own little government where you have a few people making massive decisions for people who don't really get a say in it. It sounds like it's almost like a
Yeah,
little micro healthcare government run by the actual government and corporations who make all of these huge decisions that affect our lives, and we don't really get a say in it. We have even less of a say than I even thought. I mean, at least with governments, we can kind of vote people out. With other businesses, we can just not shop there. But with healthcare, the way it's set up, you're kind of locked into a lot of this stuff.
yep. Yep, you are. And unless you have the means in a lot of places, you can't. Like, so I had this patient, sweet girl, who ended up having this had this mass on her eye. Her parents were super rich. And she could go to any, health system ever. The parents donated to all the hospitals in the area.
Mm,
And they couldn't get an appointment in to see her, urgently enough to, get an MRI, for this thing on her eye. And they called us, and we got them in right away. And it was just like wow, like, and people were like, oh, like, like, these people, they can do. But hey, if it were my kid, I would do and I had the money and the means, I would do the exact same thing. But
why
not
not?
everybody has that ability to do that. You can't just go down the street and do that. I mean, yes, that's an extreme case, but it is a definite sign of our inability to have choice and care. And transparency is huge as well too, because this is the only business that I can think of where you go in and you don't get to see how much it costs before you actually buy the product.
Yep. That's the only
Especially when you
like
have
if I go to the
procedures,
grocery
that kind of
store
thing.
and I'm getting ground beef, it says a price right on there. I don't find out when I get to the
Yep,
register unless they put it in
yep,
the wrong
yeah.
spot.
And hey, and in the mail, you can get these little flyers that tell you what's on sale and what's not. And you can go
Yeah.
to, to Costco, or you could go to the local grocery store and get it cheaper, depending on the week, right? And
Hmm.
so then in that respect, there's competition and free market, right? That doesn't exist in healthcare, right? And whoever says that's the problem, that's not the problem because it does not exist. And no, so there was a transparency rule that came out under Trump, which is actually something that my organization helped to draft and spearhead,
Yeah, so
the
let's talk
price
about your
transparency
organization.
rule.
I've been wanting to get there. So
Yeah,
you helped to create this
yeah.
legislation. Before you get into that, though, physicians for physicians for patients. You can talk, Jeff. You can say words. Uh, Tell me
Yes.
about your organization and what you do, and kind of how you got into
Okay.
helping with this legislation. Because I remember you talking about it a while ago.
Okay. Yes. So Physicians for Patients is was an organization that was born out of Facebook group frustrations, actually.
Mm,
And so I'm a founding member. I was board president initially, and so it was kind of national, kind of a internet based group.
mhm.
And we were really focused in on the issue of the Affordable Care Act spearheading the creation of the unsupervised practice of medicine, what we call it, by non-physicians. So nurse practitioners were being legislated in multiple states to be able to practice without any physician oversight. Now there's a whole there's lots of factors that went into this, but the whole point of the Affordable Care Act doing this and pushing this was one. There was a really stupid doctor who was ahead of this and decided that nurse practitioners could do primary care just as well as physicians could. So why not? They're cheaper. And then it takes them less time to go through school and to train than a doctor. So it's cheaper for them to be trained, and the, reimbursement is not the same as physicians. So let's churn them out instead of putting more money into creating more physicians to care for all of these patients now that we are about to insure. They had to have a way to give people access in addition to providing an insurance plan for everybody. Because if everybody had insurance, they needed a place to go, right?
Mm-hmm.
So and what we were learning from each other. And then in physician Facebook groups, people started complaining about referrals they were getting from nurse practitioners, or they themselves were actually going to seek medical care and they were getting pushed to see a nurse practitioner. And we started finding out the amount of variation in their training. And we were all frightened for ourselves and for our patients. So there are amazing nurse practitioners out there. We're not against nurse practitioners whatsoever. No. Sure. There's some fantastic ones that I work with in my entire career who were also, though, fantastic nurses first and highly experienced nurses, and then went into becoming a nurse practitioner so that they can focus on a single field and be a part of the support team taking care of patients. And so when they were first really, really being popular, I mean, they've got a long history of existing in the United States, but when they wwere really popularized, it was actually during my residency training, and doctors started using them for weight loss clinics. And so they could follow us, a select panel of patients or patients with diabetes. They could handle patients who did not have complex diabetes disease, a new patient, this was their primary problem, maybe had high blood pressure too, and they could manage that patient's diabetes. Fantastic, amazing. And that's how, and it functioned really, really well. But then physicians started hiring them to work in their primary care clinics. And every state had started having these very loose collaboration agreements. They required some sort of supervision or collaboration with physician, but every state's completely different.
Okay.
So greedy doctors started working less and seeing fewer patients, and basically making the nurse practitioners do most of the work, where they were actually getting paid for really doing nothing, and the nurse practitioners were doing all the work. So that was really unfair. So that made them feel like they were getting used, and hey, if these doctors think that I can do this by myself, then I should be able to be doing this by myself. The problem is the way that they train, it was vastly different in every single field, every single state. So nurses go to nursing school. Nursing school is completely different from medical school. What you train, how you learn, the depth of knowledge in certain areas, just looking at pharmacology and understanding how drugs work and how they affect the body, and mixing medications together, all of that stuff is completely different in the way that nurses learn. And they have their own kind of diagnostic set of things too. And so, and then when they become a nurse practitioner, they get an advanced degree. It used to be a master's, but now it's a doctorate.
Okay.
And initially that was more sort of a teaching position. It was designed to do that. And then they learn health lobbying as a part of that. But the clinical component, they learn by actually going and, basically shadowing. You work in a clinic, and you see patients with a doctor, but you don't really do anything primary responsibility until you're actually hired, and then you're getting trained kind of on the job. And so it's a quick turnaround. So 4 years of nursing school, which remember, nursing school is straight after high school. Right. Medical school, you still have to go to 4 years of college and then go to medical school, right? So automatically I have a nurse in 4 years, no matter what, right? After high school. Mm-hmm. Tack on 2 to 3 more years and you have a nurse practitioner. Meanwhile, the doctor is still not even done with medical school. Not even
Mm.
done with medical school. And training comes
Lester
after
Black,
that,
because
right?
remember DEI.
Yeah. 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 Oh, that's right. Yeah, DEI, but it's in 7 years DEI. So
That's long-term
there's
DEI.
practitioners now. There are now schools that that go from nursing school to getting your doctorate or nurse practitioner in 6 years. So they've cut it short, and it's sort of an accelerated phenomenon. And
Mm.
so just think, a lot of that is kind of shadowing hours. Some of these schools only have like minimum of 500 hours. Your pet smart groomer has 500 hours to learn how to groom a dog
Oh.
as a requirement. Yes. And
Yeah.
so this varies everywhere. There's no like, like full regulation. They do have to pass an exam and a board exam, all this stuff. So anyway, we were starting to get stories of harm basically to people. And one of the physicians in our group actually had a story of harm that basically hurt her career. She was completely misdiagnosed. And
Mm.
so that got us all up in arms, and reactionary. And we really just wanted to educate people about this. And once we started diving deep and following the money trail, we learned that the reason, that the money force behind this, key stakeholders were obviously the government, and two, the large pharmacy benefit managers. So
I am
if you
absolutely shocked.
noticed,
I would have never thought that those would
if
have been
you,
the culprit.
yeah,
Like if you follow the money, I would
yeah,
never have imagined
um,
that would have gone to
right.
the government and
And
big pharma.
hello, think tanks too.
Okay,
If
yeah,
you
gotta
look
have
at
a think tank.
all of the conservative think tanks actually push for this as
Ooh.
well, and they try to disguise it as a way to give patients choice, but it really is not. You're not doing that. So, but look at, there's a CVS Minute Clinic almost, on every corner.
Yes.
There's yeah, right. There's Rite Aid has their own, Amazon has their own. All of these are sponsored by pharmacy benefit managers. So CVS, Express Scripts, they have their own nurse practitioner working inside of your clinic, prescribing the medications that are on your formulary, injecting the vaccinations that are on your formulary, right? And doing all these things. And it's in a convenient place for you on your corner, right? And so everybody has access to care.
It's like the
So
Starbucks of
um,
medical care.
pretty much, right? Right? So all good. We love it, right? Well, no, like what is the cautionary tale here? Like you're not thinking about actual patient care and what is it going to do to
Mm.
medicine? I mean, like I got people who were coming up behind me interested in a field of healthcare and medicine, and they're trying to make the decision whether or not they become a nurse practitioner or a doctor, because there's a shorter route to it now, than going through all those years of medical school, racking up all this debt, all of that. So yeah, obviously,
Yeah, I can see that would
but
be more attractive.
um, yeah, but when you speak to people who are nurse practitioners who then either are seasoned nurse practitioners who had experience as nurses, or people who were nurse practitioners and then later decided to go to medical school, they will tell you that there's 100%, like 360-degree difference in the amount of information that you get, and,
Mm.
and, and training that you get. It is vastly different. And yeah, I mean, they cite studies that they use, everybody has studies. You can always
Right.
find a study that, says this drug is right for you. We saw this with COVID, Pavloxid and all of these other remdesivir. Yeah, these are the studies that showed this, but or the vaccines were working, right? So we know what studies do. You can skew the studies to only show the studies that work to your benefit.
Right.
Um, so really, this is not on the, I mean, honestly, if I were a nurse practitioner, I probably would go for this too. But the reality is they aren't really necessarily filling the void. There are some pockets of areas where they actually are taking care of patients. But honestly, if one of the reasons why I'm not doing primary care medicine is because it is, to me, the most difficult specialty in medicine. You have to be prepared for every single thing that walks through your door. Unlike someone like me in the intensive care unit, where I kind of know because my patient's coming from somewhere else and I get a call from a doctor and a nurse, so I know the story, I know the labs, I know all of these things about the patient, and so I can prepare. But your primary care, you go in with a stomach ache and it could be anything. And so you're relying on a person with less than, 500 hours or maybe a few more of just shadowing a doctor in a clinic to be able to figure this out for you. So we started educating, and then we found out the pharmacy benefit managers were the driving force. Free to Care decided to form in 2018. It is basically a large conglomerate of all of the smaller grassroots organizations. So Physicians for Patients is a smaller grassroots organization, but we had tons of them. We had parents,
part of Free to Care.
Patient groups. Yeah, we had patient groups. We had like so many of them, entities that were involved, the nonprofits together with Free to Care, and we came together and decided, hey, let's pool our resources and pick a few things that we want to lobby, write a paper, a white paper on it, go and present it to Congress. And the first presentation to Congress, I actually missed that one, but the one in 2019, I went to, and we actually presented our work in the Library of Congress. It was really cool. I had never been there before. And then we went out and, we set appointment times with all of the different, people, representatives and senators on the Hill who we knew were like on health committees and Ways and Means, and Energy and Commerce, believe it or not. And we could meet with them, talk about our ideas, and try to get them to work. And we did that for a couple years. We had some people who lived closer who could actually build much more relationships with people and get them to kind of really write some legislation. And so Trump did get some wind of us, and that transparency rule happened through that. The Medicare lowering insulin happened with the help of our organization, not completely. And then the surprise billing rule that it actually became was a legislative piece, was a part of Trump's policy too, but he left before HHS could implement it, and they have not implemented it the way that Congress has designed. So that's still like getting fought in the courts and that kind of thing. And so, and the reason is the insurance companies and lobbies are benefiting off of the way things are. And so they are very resistant. The price transparency rule was a big one too, that one of our parent organizations, a patient organization, was really instrumental in getting that passed. It is now a requirement for healthcare facilities to actually post their prices. But when's the last time you actually went to a healthcare facility and saw prices listed, unless it was a very small practice, direct care practice, direct primary care practices, all list their prices. What it's gonna be ahead of time. You can go to their websites and find out things ahead of time. But a large healthcare company, try calling and asking how much something's gonna be. The person on the end of the phone, 9 times out of 10, will not know the answer. And that is done purposefully.
I would imagine they have them somewhere, but they probably hide it to where you can't.
Yes, they do. They do. Yeah. And when you ask, it's almost like, what are you going to do with this information? I actually had that question asked of me when I was a medical director of one of our divisions where we took care of kids. Basically, I was like an anesthesiologist outside of the operating room, and I ended up having to kind of oversee our billing and revenue just because it was a mess. That's the other part of a big healthcare system. Too, is you don't get a lot of people really invested in that thing. So you end up having to wear tens of thousands of hats and don't get paid for that work. And so I was actually asking for a spreadsheet of a couple quarters of our revenue. And the person who I asked, needed to go up higher and ask their manager, and who then emailed me and asked me what I was going to do with the information before I actually got it sent. So, it's just like, what are you hiding? Like, I don't get it at all. Like, so, and if you want us to make more money, you need to explain to us how the money works, because then we know what we can do to help bring in more revenue. It's insane the way it's all just so secretive. So yeah, and so Free to Care is that, like, it's basically this big, large conglomerate of grassroots organization. We have a change in our executive director now. We've had trouble getting funding. You think about it, we're not like highly, influential in a lot of the, once you get the think tanks to disagree with you because they've been bought and paid for by the lobbyists that are against you, you're not getting funding from anywhere. So it was very difficult for us to get funding. And again, we're people who are either had some like healthcare administrator experience, parents, patients, and physicians who are working and have our own families. We can't, all of this, we're taking all these trips, doing all this stuff for free. It's voluntary and it's not sustainable long-term. And so if you don't have people who are in the game, who are actually fighting for people, this in the liberty movement, right? If you don't have people willing and capable of not just doing the work, but also funding it, because it takes money to get these ideas passed and through, and to influence people. And so that's the only, if I could have, a few $1 million to put some ads on the TV about, health policy, that could go a long way for people.
would help
Or
a
just
lot.
like to put a storm of Facebook ads alone, or YouTube, that could do wonders for us. But we have no financial backing.
Yeah, it seems like the bad
But
guys get
it's a
all the
labor of
bad
love.
backing. Yeah.
Yeah.
Yeah, it's really sad, and I've seen this in other areas of society as well. I mean, it just seems like the people who benefit from the status quo are the ones who have all the money. They have no incentive to do anything good for us and for the people, like letting us have more choices about our healthcare, and they make these decisions, and we know that we're not on their minds when we're not on their minds. Our bank accounts, our wallets are on their mind. And it's really sad
Yep.
that
Power and money. Yep. For them.
power and the money and the power, minute after minute, hour after hour. I mean, it's just it's 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 depressing, and especially getting into healthcare. I mean, this is such a beast and such a leviathan that I don't know how to even take it on. I mean, organizations like what you guys are doing, I think are going a long way towards helping, but it sounds like it's just going to have to get really painful before people actually start paying attention. And I hope I'm wrong about that.
Yep. Yeah, no, I think that's what's going to happen. I think that's really going to happen. And honestly, as I said already, we are a government-run healthcare system already. When it gets to the point where everything is, pretty much monopolized by the government, to the point where we're starting to ration things on a more regular basis. I mean, we saw a little bit of this with the formula, baby formula shortage. We saw children's Tylenol and Motrin shortages, those kinds of things. Once people like really know what's behind and causing all of those things, but when it really affects people, unless they know what's causing it, nothing's really going to change. I mean, because what we see is a blame game that goes around. one of Biden's favorite things to say is that, these businesses are greedy. Big businesses are greedy. It's the pharmaceutical companies that are greedy, that they want, this money. That's why these drugs cost this much money. That's only part of the story. And at the very least, and I'm not going to defend pharmaceutical companies, and they have we have their own issues with them, but at least they're doing research. They're
They still have a
actually,
profit
and
motive. They
actually
still have to make money.
manufacturing
Yeah.
and manufacturing drug. At least they're doing something. They're making a product. They're doing research. They're studying it. These other entities have no claim to fame except their negotiating abilities and lobbying abilities. That
Mm.
is it. It does get frustrating. But when I get to the point where I'm feeling down about it, and my friends and I, which is funny, I've made some really great friends. All started from a Facebook group where doctors were sitting around complaining. And then I was like, well, who's actually doing something? Because I need to be involved in the solutions of this.
Yeah,
So what
Dr.
can we
Nikki's a
do?
solutionary,
And,
y'all.
and yeah, it's the 80-20 rule. 80% of the people are going to sit around and complain, and 20% of the people are going to get it together and actually start working to do something. And so I'm a doer. I'm not necessarily the ideas person, but I will actually get going and be a good worker bee. And I that I found friends that way. Like, we instantly connected, worked together, and I have a great support system of people online. So a lot of people who complain about online not being real life, like for me, it has given me a lot of great friends and great support. But anyway, so yeah, when we get down and we get discouraged because you're lobbying year after year for the same stuff and it just nothing is happening, you need somebody to kind of help pick you back up, and you have to think
Yeah.
about the goals. And for me, the things that I value are my family, my Christianity, and and my health. Those are things that are valuable to me. And part of me being healthy is my mental health.
Yeah.
And and I'm not mentally well if I'm seeing a problem and not doing anything about it.
Mm.
Like, it will bother me and I will not sleep well. And so I have to be able to do something, and a lot of people don't get that. My husband doesn't even get it. It's like, well, I don't get, why do you have to say something? you know, just
Why does
put
it
your
have to
head
be
down and
you?
go to work. Yeah, and it's the police officer in him. And I mean, but he is like, once he started seeing the toil it was taking on me physically to be in a space where I felt like people did not care for the patients, did not care for the children.
Mm.
Especially COVID became really difficult and challenging. It's because I disagreed with a lot of what the hospital was doing. And it was
Yeah,
like
you mentioned that you were
really like
clashing
I
with the medical establishment, and that's one of the reasons
yeah.
why you left. Was COVID the main thing, or was there other stuff too?
That was sort of the straw that broke the camel's back, to tell you the truth, because initially it was my health policy lobbying. They knew what I was doing. They knew what I was, that I was going to
Sure.
Washington. I was actually pretty active in my state medical association too, lobbying for things. And one of the first things that really got my with a bee in my bonnet was what doctors have to do once you finish medical school, you go to residency, which is you training in your specialty, and then you sit for your specialty boards. That the oversight for that specialty boards, it's one entity. It's called the American Board of Medical Specialties. And so they have oversight of every single specialty board. So the American Board of Pediatrics, the American Board of Internal Medicine, the American College of Surgery, all fit under that umbrella. And those are the people who decide, like, this is the exam that you're going to take to get certification. And you take that test, you're initially board certified. That's a fantastic thing because it is an objective measure on the competence of a physician, and it is correlated with quality of care, that initial board system. But what they decided to do was to make it a requirement for you to recertify. And that happened while I was in school and training, and it was ridiculous. So after every 10 years, initially it was like every 7 years, and then now it's every 10 years that you need to not only take an exam, but you have to meet all of these other requirements in order for you to get another certificate of your from your specialty. Well, years of having this in place, a decade or more now, there has been no demonstration that this is of any benefit to quality of care at all. There's no correlation whatsoever. It costs money.
How much does it cost to
time.
recertify though?
So it's about the same as how much it costs when you certify initially. So that's the ridiculous part. Everything's online. So it's like
Right, but how much money are they making from this? This is
for my critical care exam, it's over $2,000. And for one test, you take, and it's a half-day test. It's multiple choice on a computer that you can take.
Ooh, I am in the wrong line of business.
Okay, right? Exactly. And then not only that, like you have to like take time out, like, because you have to have for pediatrics, there's these 4 parts of your maintenance of certification. You have to demonstrate all these skills. You have to get these great, like, evaluations, 360-degree evaluations, what they call them. So you get evaluations from residents, you get people you train, your colleagues that you work with, and the people who are, overseeing you or supervising you. And then you have to do quality improvement care too, and get so many points for this type of stuff too. And then you have to take the exam. And once you meet all of those requirements in a certain time cycle, then you get your certificate for another 10 years. So a group of doctors got together and said, hey, this is a restriction on our practice. It is not benefiting us. It is only taking away valuable time from what we could be doing, other things that we could be doing. And they formed an organization called the National Board of Physicians and Surgeons and created their own certifying requirements, which was basically the same requirements as it is to renew your state license as a physician. And so that made it easy. So all we had to do is do continuing education, and then that's it. So we some hospitals in their policies and bylaws require physicians to make sure they maintain their certification, and they can do that. They can some of them, the hospital where I worked, had a very generic statement about what it meant to maintain certification. The ABMS, that big board, created a product, maintenance of certification, or MOC, with a trademarked product that you had to use to maintain your certification. They say that it's voluntary, but it's voluntary only in that if you don't do it, then you don't get to keep your certification. So you have a choice, you do it or you don't. And so then you've given up like decades of your life and practice and skill if you don't do this. And so what MBA PAS decided to do was come up with its own. And then, so for those of us who worked in hospitals who didn't have, like, you had these sort of generic bylaws, we could lobby and say, hey, can we make this make this official that we can get our board certification pretty much, or maintain our certification, any which way or whatever. Or, and I got pushed back from my own people in the hospital. So that kind of started that. It was like, I got to jump through hoops. Well, the lawyers won't agree with this. Who gives a fuck what the lawyers think?
Are the lawyers in the
like,
in the intensive recovery unit?
Like, you should be on the side of the here. You don't like, yeah, you work for the hospital, but you are actually my chief medical officer, which means you are like the voice of all the physicians here. And so I was getting all of this pushback from that. And I really, like, once I got and then once, so they saw that, they didn't like that. I was doing podcasts. I was doing my own podcast, the Free to Care podcast, to talk about all the things that we were doing with Free to Care. a lot of those policies, including maintenance of certification fight, was a big stressful point for them. When Ohio State had a legislative a piece of legislation that was going to make to allow physicians to be able to have choice in how they maintain their certification, the American Hospital Associations, the large bodies of medical organizations also fought back to and that didn't go through. They pulled the bill because they fought against us. And that's the kind of stuff that like pisses me off. And so, for me, I'm only going to double down and like continue to try to work on this. And that's what I did. So that kind of started everything. Then I started talking about PBMs and GPOs, and they were like, and like, it was kind of real subtle at first, but when COVID hit, I did as much as I could to follow policy. And official hospital policy at the time was you basically can't go to your kid's school or any school in the community and instruct them on policy unless it is in agreement with the policies that we have here. So the hospital came up with this like toolkit for all the schools and what to do, to get schools back open in COVID. And it was completely, all the masking, the 6 feet distancing, all of that standard, BS basically, which we now know for sure because they've admitted it was completely made up arbitrary rules. And the side of me that was learning that the people that I work with, the people that I once trusted for advice, for career advice, for understanding medical science, that pool of people began to shrink really, really, really tiny to a small amount of people. And I couldn't trust people that I once respected. When that happened, and then on top of that, you're isolated. So you're isolated, like we were physically isolated during COVID. Like, we were restricted to a certain number of people per room. And where I work, where my office was where the unit that I was the medical director of, and it was completely separate from everything else. So I never really saw my colleagues for the most part. I did most of the work in the patient care, except for the nursing staff that I work with. That was it. So I was not only physically isolated, we were having our meetings over Zoom. It's ridiculous. So I was physically isolated, and then I was also, basically gagged. I mean, I really couldn't talk about this, things that I disagree with. And I would ask in like a lot of our COVID update meetings, I'd be asking questions. Are we allowed to purchase, group purchase masks from somewhere? Or, why are we continuing this policy? Some of those questions would never get answered. They would be completely ignored. And then I couldn't be silent anymore. When I saw my kids being affected by these stupid policies, I really struggled. So the social isolation affected me too. I need to like be able to be around people. Like I'm in some ways I have a little bit of an introvert gene, but I do much better when I'm around people.
Right.
And I couldn't openly talk about things. Not only, my conservative view is completely different from everybody. I mean, I live in a blue county. I mean, I lived in a blue county, not anymore, but in the hospital systems were all very, very, a Democrat. And so they were doing whatever Fauci said. And anybody who brought up anything that was completely different was either ignored, blacklisted, or just, ostracized. And so that was like, so even before that, and my colleagues knew where I stood on a lot of things, because I'm vocal on, social media, and some of them were following
Yeah, you
me.
don't really keep your mouth
But
shut.
when I couldn't, I
Yeah.
can't do it. I cannot do it. It is a problem. For sure it is. It's a problem. It's a blessing and a curse.
Yes.
It really is. And I started having more trouble. Like I was like getting called into my supervisor's office, getting called to HR for things. And then once I started saying things about COVID, that's when someone started finding out, looking at, actually basically stalking my Twitter account. And I later
Mhm.
found out it was one of my own colleagues who
Believe it
was
or not,
stalking, and
I've
then like,
talked to many people who have had that happen to them
yeah,
outside the medical industry.
yeah,
But and for people watching this, like I understand why some people go anonymous on social media or they're afraid to speak out because
yep,
there are Karens out there that you work with that will go and cyber stalk your social media to
yep,
find anything that they can use to bring to your boss to try to get you in trouble. This cancel culture stuff isn't just for Kevin
yep,
Hart and other celebrities. It happens to everyday people all the time, and we don't
yep,
know about it because we only pay attention when it's a famous guy. But there's people who this is happening to all the time, just based on political views expressed on personal time on social media.
yep, yep, and exactly. And it was, and so those Twitter posts was someone actually tagged the hospital on one of my posts because it was about not wearing a mask anymore. Because like the mask thing was just ridiculous. It was beyond. We were wearing masks every single day in the hospital for years. And at the point that I posted that, I was absolutely fed up. And and someone reported that post to and tagged the hospital in on it. And so that started the stream of like constant, tweets. And I'm meeting with human resources, and I'm sitting there having to answer questions about tweets that I posted. And I am, of course, just like I always am, I just as much as I could. I was very professional, but I didn't hold back. And
What kind of
then
questions were they asking?
the kind of the thing that really set it off is when I accused. It was okay. So you said that the myocarditis thing with boys, that's been debunked. The and I'm like, no, it hasn't. It hasn't. This paper out of Israel showing this or blah blah blah. It has not been debunked. Well, you're going against the AAP, the American Academy of Pediatrics. I'm like, yeah, I am. I said that like because they're
And
wrong. They basically made a conclusion about this vaccine causing myocarditis in kids and basically saying that it was not associated that without using any data. And now we learned to find out that they actually had data and they hid the data. So it's
mm,
like, but at this time, I'm looking at multiple sources. I'm looking at European sources of data
right.
everywhere. I'm not just looking at what the American Academy of Pediatrics is because I stopped trusting them way back. I started distrusting them early on in my career, but in 2018, when they came out with their gender policy, that's when I left and I wrote a scathing letter to the president and I left. So at this point, I had no respect for the American Academy of Pediatrics anyway. So you're going to sit here and tell me that I'm supposed to verbatim agree and say what the AAP says? This was literally said to me, you are going against the AAP. Yes, I am. And that's exactly what I said.
Mm.
And so yeah, there was that. And then there was also and then it got to be really nitpicky. Like your Twitter account doesn't say these are your views and not the views of your employer. So I was violating hospital policy by not stating that explicitly. I'm like, well, my Twitter account never mentioned my employer ever,
Right.
ever, never mentioned my employer. And well, the person who found you, Googled you and found you found you and knows where you work. Like, well, you know what? My Cleveland Clinic photo is still up. Like I'm listed as a physician there, and I don't work at the Cleveland Clinic anymore. So, I can't. you know, whatever. Yeah. So you can see how that's a dilemma for us. I'm like, no, I really don't. It's me expressing my personal opinion. And obviously this person who reported it knows that this is different from the hospital policy. So how can you logically say that I am trying to express views that you know, that represent this company? So whatever. So I got that involved. And then when they really got upset was when I said, now the hospital is mandating the vaccine, but only when there's money, only when there's money on the line. That's what really got them hot. Because we were not mandating the vaccine. We were one of the remaining hospitals that never mandated the vaccine. They never mandated the flu. And as soon as Biden's HHS came out that they were not going to reimburse for hospitals that didn't mandate the vaccine, that's when the order came down. I have a screenshot and a printout from when the CEO of the hospital made this announcement, and it included a statement that the Biden administration is mandating this. And so, and then they pulled it when the injunction went forth against that rule. And then, and they stated in there, because there's an injunction, we are going to postpone our requirement date, for activation of this policy. And then once the injunction failed and the policy went forth, another email sent from the chief, the executive of the hospital. And like, so you said that the hospital is only doing this because they want money. And I'm like, yeah, that's the deduction I can make. That, it's pretty logical.
Yeah, if you guys actually believed in this shit, you would have been doing it without Biden mandating it.
Exactly, right? Yes, exactly. So, you weren't doing it before and you caved in only when it was demanded to you. And you stated that very plainly. So I just I
How
so
dare you bring up stuff that we actually said publicly?
So you can see how that might have not been taken easily. So so really, and then, but this actually, I can joke about it now easily, but it really was very difficult to work in this environment because I was actually being now like under a microscope. So every little thing that happened, any little complication that happened with a patient, I was in the office having to explain things. And, I had an excellent patient record. I have people who still find me like out of the blue. I run into somebody that I took care of their kid years ago and sedated them to get them through an MRI or some other painful experience. They come up to me and said, "We loved you. You were awesome. You made my daughter's, or son's experience so great." I still have that. I know that I have that record. I'm still friends with my nursing staff. And and they still view me that way. But I felt like I started to question my own abilities. I felt like I was, obviously an outsider. I thought I was the one taking crazy pills because everybody else was going along with this stuff. And so it is, when you already have insecurities about yourself, which I did for a long time. I always felt like I had this imposter syndrome, like maybe I was like, I'm not supposed to be here, but no DEI here. I had a great science GPA. I graduated cum laude from undergrad. Medical school was pass fail, so I don't know what my rank was, in medical school, but I got great grades on my US, my state licensing exams. I didn't do, I did okay, like within, average of my board certification exams. But I mean, you don't pass the critical care. And I actually struggled with that one. That one was a tough one to pass. So it was a hard test. So no, like I'm not like this medical genius, but I was definitely pretty qualified to be there.
You
So
put
like
in the work.
that's not an issue, right?
Work.
But I still struggled with that because there are some people who can just like some people, some of my friends, I just hate them because they just have a memory like nothing. And they can sight read and like read and remember something. so easily, and like, and that photographic memory, and I just don't have that. And that, like, you can excel in medicine because it's a volume of material like that, and being an attorney because there's so much volume of material that you need to know. And I had to work really, really hard for everything. And so I did, go through that like kind of questioning period, and then whole, being a woman, being a Black person, I was told my whole life that you got to work harder. And so that, of course, that affects your psyche,
Yeah, it does.
anyway. But I knew I was good. I knew I was damn good, So, but at that time, when you're being socially isolated and ostracized, then you really start questioning yourself. So I started hating going to work. I started doing
Mm,
things that were against my own ethics, like, leaving residents unsupervised, things like that. And that wasn't good. And once I recognized that about myself, I knew it was time to go.
mm,
And so, and I did. And physically, I was actually not doing well. My autoimmune disease flared up. I was probably the worst, like physically, than I had ever been. And my husband said to me, he's like, for the life of me, I don't understand why you have to like always voice your opinion, but I can respect that. And I know that this is killing you. You need to leave.
mm.
He's like, you have to leave this. You have to find a way. And the one thing that makes it difficult to leave medicine, and which is why I believe a lot of people did not speak out who believe all the things that I believed about COVID and gender medicine, all these things, is because you invest so much time and money and sacrifice into becoming a doctor, and especially a good doctor, that to give it up is like you're basically giving it up and you're branding yourself. Because if you're speaking out about against things, you really get branded as a disruptive physician, and it's not going to be many places that are going to hire you because there's a way that they can, it's a small field. Pediatric critical care is a small field, and what I was doing, I was so specialized, but there was nothing even close by, and that I could actually go to and practice. And it wouldn't have been easy for me at almost 50 at the time to go and start my own independent practices, which I would have done had I been younger. I would have gone and try to do that. But for me, I really had to walk away from it. I had no other choice, or I needed to leave town and leave my family, and have them join me later, like once the girls graduated from school or whatever. And I wasn't
Yeah.
willing to do that because my family was the most important thing to me, my husband being my biggest support system. And so, my parents were here, everything. And I was actually, at the time, I was full guardian to my dad's estate, and his person. He was in a long-term facility with horrible Lewy body dementia, which made him psychotic and feel like he was on
Mm.
fire all the time. And so during COVID, I went a year without seeing him. So I couldn't leave that responsibility either. And so it was just a lot of reasons, but that is the big reason why a lot of people don't speak out, because it is a huge sacrifice. And, there's people, yelling at them on social media that you should have been speaking out. You were part of this. You're part of the problem if you didn't speak out. And you're like, you know what? You're asking other people to sacrifice something when you're not willing to sacrifice. It's easy
Exactly.
for you to get
Yeah.
on and say these
Yeah.
things, especially if you work independently, or you don't work at all, or,
Especially if
it
you're
is
an
not
influencer. I
easy
mean,
for
you get
everybody
paid
else
to
to
give
do
your
it.
opinions and you get paid to be controversial. It's easy for you to say that.
Yep.
But for regular people
Yep.
who are in a politically charged atmosphere, which you were, still are, which because basically everything's political nowadays. But yeah,
Yep.
there could be some very real life ramifications and consequences for yourself and for the people who depend on you if you dare to speak out. So yeah, I would love if more people would speak out. I understand why they don't, because the bad guys have created this atmosphere where people will they don't even have to censor people. They get people to censor
Yep.
themselves
We
by
self-censor.
threatening them.
Yeah.
Yeah.
Yep. Yep, exactly. And so, and I could bite my tongue for only so long. So and self-censor. So
Yeah.
I just couldn't do it. And when you're in an environment, especially when you're around a lot of people on the left, they can speak freely. And they
Yeah.
think that they can't, but they can speak freely about their political views or how they
Of course.
view a situation, because they feel like everybody else thinks the same way that they do. And it may be different in like in an area that's like strictly conservative, because I could probably say, like, I'm in my new neighborhood, I saw somebody with a bumper sticker that, that had a ribbon on it for, the cure for liberalism or something like that. It was just really funny. But like, you're not going to find that in the middle of, the city of Cleveland, in the parking lot at, at the university. You're not going to see
Yeah.
that because, those people are silenced. But you have the car that has the Biden sticker and the coexist sign and end
Don't
racism
forget Black Lives
all in
Matter.
one. And Black Lives Matter. Seen few of those lately, but they're still, out there. Those are proudly displayed, and it's okay. Like, I even had like one of my doctors I saw walking through the hospital one day. He had yard signs that he was going to give out for Biden during the 2020 election. And he was walking them through the hospital, taking them to his office to hand out to people. And it was just like, you would never see somebody with Trump signs walking through the hospital like that. So it's like for them,
Because
it's
then they
like it was
might
so
actually need
easy.
a hospital after doing that.
Exactly, right? Right. But I don't know. People around me knew. Like, I didn't care. I don't care. You're gonna know you know what I think. I'm going to respect you for having your view. I'm not going to be disrespectful to you. But and if you don't want to listen to what I have to say, you don't listen and you don't follow me. That's how simple it is. I'm not going to hide who I am. And I tried to for a while on Twitter. I had a separate professional account and from my own like kind of political personal account, and it was really hard to maintain those. And I had like no picture, it was anonymous, all this stuff. And but it just was like, why am I doing this? At a certain point, I'm just like, it's too much work to try and do this. And I'm not really like, that account didn't even have nearly as many followers as my political one. It's like, I need to be, if I'm going to be talking health policy, I'm going to do this on the account that has the most followers.
Yeah.
And if people don't like my politics, then oh well, then they don't have to follow me. But now I get to work with people who have different political perspectives
Hmm.
on things, but share a lot of the same ideas for change. And I don't think I would have gotten here not being a vocal person.
Yeah.
And so it's politically vocal, and it was my kids even asked, Mommy, why do you have to always like say stuff on like, and part of that came from we actually had the kids' school. They attend this all girls private school, and one of the parents invited the speaker to come and talk about basically gender, and she was very pro gender affirmation, and she was giving a workshop for the faculty and for the parents. And I had questions like to the heads of school that um, was this going to be something that the teachers were going to take and actually use as part of their teaching, or their communications with our daughters? Was this going to mean policy changes at the school, especially it's an all girls school? Were we going to now allow boys who are identifying as girls to come? So I asked this question in a very public way because I didn't have another format to do it. And that public way was to basically use the all school directory. And mind you, this school
There
goes
we
from
go.
pre-K, early childhood, to 12th grade. And I emailed everybody
You just
with
couldn't
my
help yourself,
questions.
could you?
No. And then my kids, before I even got to tell the kids, their people were walking up to them and asking them about it. And I just, oh shoot, oops. But yeah, so why do you have to talk to everybody about everything? Why do you have to tell your opinion? But this is why. Because then I formed a parent group out of this, because I got a lot of people who were afraid to speak up saying, we agree with you, let's do this. And so now, I get to help educate the teachers. And I ended up meeting with the head of school. Come to find out, she had no idea you know, what topics were discussed at this thing. And she really didn't have a great direction for her faculty on how we're dealing with this gender issue in schools. And like, okay, well then we can do some education to educate the educators. So
Yeah.
this isn't happening because the public schools were getting a lot of attention because of Zoom school and all of that stuff, but the independent schools, you know, are not. And you know, so but we're finding this stuff happening. So let's teach them. Let's use this opportunity. So yeah, it pays off to be a loudmouth sometimes.
Yeah.
Times. And you know, you get conversations with people, but as long as you're respectful, you really do get a lot more out of it than you would if you go like blasting everybody like, hey, wait a
Right.
minute, you're sending this bullshit all of my kids, you know, like you really have to find a way to do that. And you can be, so you can be controversial and still have some respect. And just like your account, like you get a lot of people who follow you who disagree with you,
Mhm.
and but you can have a great conversation with them and you know be open and frank, and we can, and if you're obviously honest and you stay in within your principles, you always stand on them no matter who's you know violating them. um you're going to have a lot more get a lot more respect from people. And so I try to do that. I try to maintain you know my values and uphold them no matter who's in you know in violation of them. And I think once you do that, you can be effective at getting a message across. So
Yeah, and I
I'm
think
very lucky. I'm very blessed to be able to do work now as an independent consultant and do writing, host webinars, things like that on topics that are pretty controversial, but necessary for people to learn about.
yeah, and I think the cool thing about it is that standing on principle, I mean, yeah, you're not going to get, hundreds of thousands of followers overnight doing that. I mean, I think
No.
you and I both know we could put on MAGA hats tomorrow and start telling
Yep.
everybody what they want to hear about Trump, about MAGA, about Democrats, and always towing the line, and our following would jump up overnight. I mean, that's just a
Yep.
fact. Or if we wanted to go full
Absolutely.
Democrat, we could do that too. But when you're standing on principle, you will alienate people. And sometimes I do alienate people on purpose because I want to attract
Yep.
a certain
Yeah.
caliber of person. So to
Yes.
me, sometimes when I
Yeah.
say things, it might be how I feel, but I might be saying it a certain way because I do want to see if I'll lose people. And if I do, fine.
Hmm.
But I know that the people that are start to follow me after that, I'm going to get more people who are quality, who maybe have a
Yeah.
bad sense of humor like I do, but also are
Hmm.
actually serious about discussing these issues without just being
Yes.
100% partisan. So
Yeah.
it is harder.
Yeah.
I think it's more rewarding. You can still look at yourself in the mirror in the morning.
Yeah. And like and you want, you know, you want people to be able to challenge you. So, you know, I have people that I follow or, you know, or I don't mute or block because they're actually challenging, you know, my thinking. And so I want that obviously, like Sonny Johnson calls it sharpening your knives, right? That person helps you sharpen, you know, sharpen your knives. And that's what we need, and that's what we need to grow. And I firmly believe that. And I think that a part of a lot of the problems that we're seeing in medicine is the politicization of medicine. And that we saw with COVID policy. We see the same thing with this gender policy, medication prescribing, over prescribing of medications like SSRIs for depression, anxiety, benzodiazepines for anxiety, and sleep. We're seeing all of these things because there's this politicization of medicine, and you
Yeah.
know and this just kind of this self-censoring. So you have this, like you said, like this small group of people kind of making all the decisions, and that's huge because we've silenced dissent. And when you have the federal government um leading with policy that censors voices, like we saw with COVID
Yeah.
actively. Like now, like we're waiting the decision for SCOTUS about this Murphy versus Missouri case.
Hmm.
That is huge. That's going to be huge because if they're allowed to do that, then we're screwed. You know, forget the democracy anymore. Like this whole American experiment is done if our government can shut us down. and not allow us to have discourse. Because then if the government does it, then every other entity can do it. And, you know, and corporate, you know, private groups can do their own thing. But if we can't have great scientific debate, which is what medicine and science are supposed to be, we don't advance. We just have dictators basically saying you will take this medicine or you will do this in order to function in public society. Yeah, we're screwed. So to me, it's a personal responsibility of mine to help try and make this right. And at least if I do nothing else to give the information to patients and people out there seeking good quality care so that they know what the red flags are. And they know what to look for in a quality physician. It's difficult, and we joke about DEI, but actually DEI is becoming a huge problem in medicine. It is not everywhere. Recently highlighted the most was UCLA's medical school. I don't know if you saw those posts from Twitter where a whistleblower gave leaked video from a DEI lecture to a journalist, and that and the journalist was Aaron Siberian, who actually I worked with on some COVID stuff, on some politicization of medicine, an article for, and it's really the problem that I see with DEI is completely different than what our favorite, you know, woke right conservatives see
and
the
I did want to
problem
talk
with.
about
They're
this.
worried about, yeah, they're worried about protecting their whiteness. I'm worried about protecting information and First Amendment as well.
So yeah, so let's
I'm
talk about
worried
that for a
about.
second before we sign off. I want to
Mhm.
talk about that because when I make fun of the woke right for thinking that everything is DEI, people think that I support DEI. That's not necessarily true. There are some issues with
Yeah.
DEI. The problem is like y'all aren't even highlighting any of them. You're just making shit up. Like
Yes,
a wheel falls off the
exactly.
plane and you think it's because a black guy worked on it because of DEI or something
Yeah.
bad happens. You
Yeah.
blame it on DEI. Yeah, you guys are being morons about it. You guys aren't even serious. If you wanted to deal with the problems that it actually causes, you would identify those instead of just turning it into a clown show. So from where you sit, what are the actual problems with DEI?
And so, you know, first of all, I think the social media pull, especially with these pundits, you know, who people just want to make money. If you show videos or like one post of, you know, or proof that someone was hired just for their skin color or just based on their gender identity or whatever, then that's proof that it's happening everywhere. So it's like, it's like, okay, no, that's not what DEI necessarily is. DEI is rooted in Marxism. It wants everyone, that the people who design it want people to see people in two groups, oppressed versus oppressed. And they get to decide who those people are. And everything else needs to, every policy needs to evolve around oppressed versus oppressed, and it pits people against each other. That is, and really that becomes the elite versus the non-elite, you know, that kind of, it really just creates a binary society, which is how Marx, you know, viewed things, and Lenin and stuff, like Mao, all of them pretty much had a different version of how that worked. And so that's really what the root is in every single one of these real DEI policies. Are there places that are hiring people just because? Yeah, absolutely there are. There are people who are like misinterpreting it or are afraid of legal ramifications if they don't hire the one trans, you know, male or non-binary person or the one Black person who's an applicant, who may be qualified, but not necessarily like the best qualified, whatever. Is that happening? Of course it is. We're human. Like that's, but is this like written policy in any place? I've not really seen it. Like maybe uh, when you look at lowering standards for things, like lowering standards for police forces, lowering standards for air traffic controllers, that thing, there's a lot of factors that play into this. We've outsourced a lot of our manufacturing, a lot of our labor force in this country. And so it's really difficult to, and obviously right now for police departments, it's very difficult, especially in blue areas, to find people who feel like they're going to be supported and want to take the risk on their life to actually do that. So you're not getting a lot of people, quality people, to step up and apply. So are they lowering standards in some cases? Sure, that's happening. Absolutely. But is that because of diversity? I don't think so. I think it's a need for,
Yeah, that they need
it's just a
officers.
need for
Yeah.
employed people. Yeah. So like you have to look at everything. To me, I'm everything has nuance, and you can't just kind of make blanket statements over things. So, but DEI is a problem. It really is a problem. And in terms of in medical education, it is becoming more of a problem. The leading or the only organization that basically oversees medical schools and colleges in the United States. It's called the American Association of Medical Colleges, the AAMC. They write basically the curriculum that every medical school should have to, be like certified medical school. And their newest policy that came out, I think, like, I believe it was either March or May of this year. Their leadership said that DEI really needs to be a focus. And when you actually kind of look at their outline and their rubric, it does state like specific areas of where they could actually, create more diversity and inclusion and things like that. There is no explicit policy that says we need to, hire, we need to lower the grade point average to hire people. That individual medical schools may do that, but there's like no blanket like organization that's doing that. Are we, and we've started in medicine lowering standards for certain things, or changing the way we standardly do things, like creating a pass-fail for the U.S. Licensing examination. There's 3 parts to it, and the first part, was really a comprehensive knowledge of kind of basic physiology and basic pathophysiology. And most medical schools actually require a it's like a final exam basically that you take anyway, as a precursor to you taking and passing the USMLE, because that's their gauge of whether or not you're going to be able to pass. So most medical schools do that, and it's great, but they changed the USMLE score to like a pass fail. Some of the schools even decided that they're not going to require medical students to stay overnight in the hospital and take call, because they didn't feel like it was beneficial or whatever. But really, a lot of that stems from students complaining. And so there's a great podcast. Gosh, I have to get the link for it. I can't remember the name of it right now, but there's actually a great podcast, and it's one by one of the medical organizations, but the person who's doing it is a doctor who's like trying to figure out what's happening in medical education, because it is a reality that fewer people are passing the US licensing exam. Fewer medical students are passing what we call shelf exams. So when you do a rotation, say your rotation is in family medicine, you do that for a month, you have to take an exam afterwards in order to get a passing grade in family medicine before you graduate from medical school. And so you take this exam, and it's a standardized exam. Fewer people are passing these exams too. And so this is a problem. But why is that happening? A lot of people were complaining. We are in this state right now that people are so on the defense about things that people just want to appease. And when you look at what we've done with the gender identity thing with kids, and how we just make them happy, just do what makes them happy. That same thing is happening in medicine too. That same thing is happening in journalism. It's happening pretty much everywhere. It's like, you don't want to piss people off because you don't want to get a lot of big publicity. You don't want a lawsuit. You don't want to get fired. You don't want to get branded as an insensitive person. All of these things play a role. So the faculty will get together because the students are complaining, and then they decide, okay, well then we'll just, appease them here. And we are doing more and more of that. That is happening. That is a real phenomenon that is actually happening. And I don't think that has anything to do with DEI. There's this whole push for wellness in hospitals and medical education, because one of the number one killers is suicide for people in health professions. And so medical school students who commit suicide, medical schools feel liable. Resident training, and then burnout rates are high. So you see people, like, as we talked about in the beginning of this, people are leaving practice early, leaving academic medicine early to go and just kind of work clinical medicine. And doing other things, or doing things that, like, taking jobs like what I'm doing, where I'm still a physician, but I'm doing non-clinical things, period. And so people are leaving, and what their answer is, okay, well then let's please everybody, because that's really what it is, so let's make life less stressful. Let's do these wellness workshops for people. And wellness has become, appeasing people is really what it's become, because this stresses me out, or this is not a safe place for me. Can I take this day off? I need a wellness day. That kind of thing is becoming much more popular. And so I think that plays a big role in what's happening in terms of the decline in medical care. And then on top of that, you got the politicization of things. So why informed consent? We're not really seeing with vaccines. We're not seeing with certain drugs because the data is not transparent. We're seeing a lot of unethical things that are happening in medicine and science. And so this is definitely multifactorial. DEI is just kind of one small component, but it's not like really as big and as pervasive as people are making it out to be. I think the quality of medicine is suffering because of everything else that we've talked about today. The corporate involvement, the politicization, all of that. That's what I'm worried about more than anything. So yeah, but do we need to answer for DEI? This is the problem is when you completely react to it and say, okay, well, let's just ban DEI because it's really bad. It is bad. It really is bad. No school, no medical school or corporation should be like compelling people to participate in these types of training courses because you have to learn this new language that you're supposed to use. It's really like compelled speech is what you're doing.
Yeah.
And actually someone brought up a great case for this being a way that you are actually practicing psychology or doing psychological techniques without necessarily allowing the patient, the person to consent to it. So, because really it's almost like a brainwashing, the way they bring up, and I don't know if you've ever sat in any of these DEI type of, or been exposed to any of these kind of workshops, but it is very much, this is the language you should use. This is how you should talk to these people, or, this certain group of people. And it's very much training your mind, which is psychology, right? And so are they using psychological techniques? And if so, when you go to see a psychologist, you actually sign consent. And you get told, you agree to participate, or you can leave. But with this, you're required to do it. And so those are the problems that I see with DEI. That's an issue.
I feel like
and does it need?
Go ahead.
Go ahead. I'm interrupting.
I was just saying, I feel like in like the 5 minutes that you've been talking about DEI, that has been like the most productive conversation that I've seen on DEI in a long time. And we got to do another one where I feel like we went for almost 2 hours and we just scratched the surface of a lot of this stuff. Like you and I can have a full hour-long conversation on DEI. And actually, I do want to do that with a lot of this stuff. So we definitely have to do this again soon, because there's just so much meat here, and there's so much that people don't know that they really should know. And that's what I like doing on my show and in my writing. I like presenting things to people and breaking it down in a way that's easy to understand. But my last question, though, is with all these problems that we've talked about in healthcare, what is there that you have seen lately that at least gives you maybe a little bit of optimism, or maybe even a lot of optimism? I'll take that too.
Well, I can see, working with FAIR, which is it's very interesting. We're actually trying to brainstorm or kind of a rebranding, because it's a foundation against intolerance and racism. It's really more that we're actually pro, kind of diversity of thought, and like there's things that we're
Mhm.
more for than we are against. And so, but what I've found in working with these people and working with people in restored childhoods is there is um, I think a growing group of people with heterodox types of thinking. And, and we're finding ways to be comfortable speaking out um, with truth, basically, and not necessarily conforming and giving people a voice for that. And so I think that growing this population of people, from journalists to thinkers and academics and just regular people, is the way forward. Where we're only going to we have to be able to have these conversations. We can take on the difficult topics, the controversial topics, entertain different voices about them, and do it in a respectful way. And I think that is possible for us to be able to do. Am I going to change healthcare, like dramatically by the work that I'm doing with Fair Restore Childhood? Maybe some things, maybe not all things. But if I can participate in helping to inform people about what things are out there that are not benefiting them, or things that I can present tools or solutions to people that they can self-advocate, then I think people, once they know and they are equipped with that information, they have no choice but either to accept it or not. And to me, that's, if and influencing people in that way is a positive thing. And that's how I see it. It's just my little piece of the world. I'm contributing, in this way, and each of us has our own gift and thing that we bring. If we look at it in terms of a big, like a whole, and we see like all the negative things going on in the world, of course it's going to look depressing.
Yeah. Yeah.
But I think there's really good people. A lot of people have good intentions, but put forth bad policies and bad solutions. But there's plenty of people out there with good solutions and good intentions, that those voices just need to be bigger. And I think eventually um, we will get to a point. I don't know if it's going to happen on social media, but I think there's going to have to be a pivotal point for people, looking at least at journalism. I mean, you look at all of these large news organizations who are losing money, and you have to go in a different direction. At some point, they have to realize, okay, we're not going to make any money. We have to do something different. I think it'll happen. I think it will. I'm always a glass half full type of person.
Good.
So yeah, that's where I am.
Awesome, awesome. And I think if all of us, or at least most of us, were doing what you're doing, seeing a problem and actually working towards a solution, we probably wouldn't even be having this conversation today. But that's the world we
Yeah.
live in, and we're going to keep having these conversations. But before we sign off, why don't you let everybody know where they can find all your stuff, all your awesomeness?
Oh, okay. Yeah, my hands are in a lot of places, but my two main gigs are now Fair for All. I am the interim director of Fair in Medicine. The website is fairforall.org. Restore Childhood is really one of my big babies. I didn't even get to talk about Restore Childhood very
We're
much,
going to
but
do it next
that was
time.
born out of COVID. Yeah, that was born out of COVID. And basically advocating for children. I write for the Substack, and we're also promoting our gender toolkit right now that we just created. So gendertoolkit.com, all one word, and restorechildhood.com. Pretty easy. Look for us on Substack, and I have my own Substack. There's always a solution. So I don't write as much on that, but I try to write something every now and then. So
I hear you
that's
on
it.
that.
And on Twitter. On X at Not a Provider MD. That's that's
Not a
me.
Provider MD. Awesome. Okay, great. Well, thanks for joining us. And we got to do this again, really soon, like not too long from now, because there's so
Absolutely.
much that we got to talk about. So thanks for joining.
Yes. Yep.